Hello everyone. Today the topic which we're gonna study is the osteoarthritis. The osteoarthritis is the age-related degenerative synovial joint disease. It is characterized by hyaline cartilage breakdown, hypertrophy of the bone, and have a minimal inflammation of a joint. What causes the osteoarthritis? The causes are divided into two types, primary and secondary. The primary is also called as an idiopathic. It is without any apparent initial cause. It results from the aging phenomena. Due to aging, there will be a wearing and tearing of a joint, so it will cause a arthritis. It is usually oligoarticular. It means that it usually involves a single joint. The second one is a secondary cause. The secondary cause occur mainly in a younger patient. The patient have a predisposing factor such as he has a she should have a joint deformity, previous joint injury, or any underlying systemic illness such as a rheumatoid arthritis or an SLE. After causes, let's study the pathogenesis of the osteoarthritis. In the osteoarthritis, there is a degeneration of an articular cartilage. To understand the pathogenesis, let's study a synovial joint first. You can see here the knee joint. The knee joint have an articular cartilage and covered by a synovial membrane. In the osteoarthritis, there is a degeneration of the articular cartilage. The articular cartilage mainly serves as a low friction surface. It transmits the load to the underlying bone, and it resists the compression. And how it resists the compression is due to is the viscoelastic forces of the extracellular matrix, such as the type 2 collagen, proteoglycan, and water. In the osteoarthritis, the viscoelastic forces which were provided by the matrix of the articular joint get destroyed. How it get destroyed? Due to repeated trauma, age, and systemic illness. It caused the damage to the chondrocyte. The chondrocyte the chondrocyte release a chemotactic factor such as a mineral metalloproteinase P, TGF, and the tumor necrosis factor. These chemotactic factor will act on a matrix and will cause a destruction of a collagen type 2, which is a main component of the matrix of the articular joint. So it will result in the loss of the extracellular matrix, and it will lead to the osteoarthritis. So as a result of the loss of the extracellular matrix, will cause a breakdown of a hyaline cartilage, hypertrophy of the bone, and it will induce a minimal inflammatory reaction due to the presence of a tumor necrotic factor and the TGF beta, which are released by the chondrocyte. In a nutshell, in the osteoarthritis, due to any cause, there will be a destruction of the chondrocyte, and this chondrocyte will release a chemokines, which will cause the destruction of the collagen type 2, which is present most commonly at the articular cartilage, and there will be a loss of the matrix from the articular cartilage. So this will lead to a hyaline cartilage breakdown, hypertrophy, and minimal inflammatory reaction, which it induced due to a tumor necrotic factor and other chemokines. Now, what will be the clinical feature of the osteoarthritis? The first one will be an insidious onset of a pain. The bone pain fiber will get irritated by the movement. There will be a dull, achy pain which worsen with activity and improve with rest. There will be a joint stiffness, usually in the morning or after inactivity. But the joint stiffness in the morning usually lasts less than 30 minutes. It is in contradictory with rheumatoid arthritis, in which the morning stiffness lasts more than 1 hour. There will be also a restricted to the motion. Due to the destruction of the articular cartilage, there will be a bony enlargement at the joint space. So it will limit the movement of the joint. It will also most commonly affect the weight bearing joints such as hip, knee, cervical spine, lumbar spine, and it can also involve joints of a hands. So, how you will diagnose an osteoarthritis? The diagnosis is mainly clinical. In WBC, in synovial fluid is usually normal. There is other blood tests will also be normal. It's usually a clinical diagnosis, and the X-ray will show a supporting evidence. The X-ray will show a joint space narrowing, subchondral sclerosis, osteophytes, and a subchondral cyst. These X-ray findings we will study now in a subsequent section. Here you can see a joint space narrowing in a patient having an osteoarthritis. The narrowing usually occur at the weight bearing side of a joint, which is usually a medial side and the knee joint. So what will be our finding in a patient having an osteoarthritis at knee joint? There will be a joint asymmetrical joint space narrowing at a knee joint. Second X-ray finding in a patient with osteoarthritis is a subchondral sclerosis. It is a thickening of a subchondral bone due to increased collagen with abnormal mineralization. How it occurs? As we know that in osteoarthritis there is a disruption of an articular cartilage. So at the disruption site, there will be an increase mineralization of a bone. So this is called as a subchondral sclerosis. You can see this subchondral sclerosis in this X-ray by seeing at this blue arrow marking the subchondral sclerosis. The next X-ray finding in a patient of osteoarthritis is a osteophyte. This is also called as a bony spur. It is a thickening of a subchondral bone at the joint margin. It is often present at the insertion point of a tendon and ligament. It is most commonly presented at the periphery of a joint. You can see that in this image, but it can also present at the center of a joint. The last X-ray finding in a patient with osteoarthritis is a subchondral cyst. The subchondral cyst is the fluid-filled sac. Like an accumulation of a synovial fluid in a bony cracks, which will form a cyst. The yellow arrow in this image is showing a subchondral cyst in a patient osteoarthritis. After an X-ray, we will study an osteoarthritis in hand because the hand has a characteristic marking for an osteoarthritis. The first one is that it involves a distal interphalangeal joint. It is a characteristic of osteoarthritis because the distal interphalangeal joint are spare in rheumatoid arthritis. It also involves the proximal interphalangeal joint. The metacarpophalangeal joint is spared, and the first carpo-metacarpal joint is also involved in an osteoarthritis. Apart from the small joints of a hand, there is also a nodal metastasis of a small joint of a hand. It includes a Heberden nodes, which is mostly involved at the DIP, and the Bouchard nodes, which involve the PIP. Remember this by mnemonic by Heberden, have H in the name, and it is present at height. So the DIP is at the height, so the Heberden node is at height, called involve a DIP joint, and the Bouchard node is below, so it's involve a PIP joint. So how these nodes form? These nodes are actually caused by the bony outgrowth and the osteophyte. With over time, the pain reside, but the swelling remain, and it is form nodes at the PIP and the DIP joint. It most commonly involve the middle and the index finger. Now coming toward the treatment of an osteoarthritis. The treatment is very difficult. We cannot treat a patient with osteoarthritis because it's a slow and insidious process and to ultimately destroy the whole joint. But to manage it, we have to first step is a lifestyle modification. We will advise a patient to lose weight and use an assisted device. So these two process will reduce the stress on a joint, so it will cause a less destruction of a joint. The second one is the medical therapy. The medical therapy include oral NSAID, but the oral NSAID is the first line therapy, but we should watch for the side effect of an NSAID, such as a GI upset and a kidney abnormality. The next medical option is a topical therapy. In a topical therapy, we use a 4 gram of a diclofenac gel. 4 gram of diclofenac gel is applied 4 times a day, and it show a good response in a patient who are above 75 years of age. The third medical option is a duloxetine. It is a selective serotonin and a norepinephrine reuptake inhibitor. It is used when there are multiple joints are involved and the pain does not improve in an NSAID. The other drugs such as opioid, acetaminophen, intraarticular injection of a steroid, and the converted sulfate can be used, but it shown no benefit in recent studies. After medical therapy, the last resort is surgical treatment. In surgical treatment, we use a total hip and knee replacement, and it is the most effective treatment. And a patient can have a pain-free life and have a normal life for about 10 to 15 years with joint replacement. So how will be a typical case of an osteoarthritis presented in a board question and in clinic? It will be an old person having a joint pain. It will involve both the PIP joint and the DIP joint. On the lab test will be normal, or on arthrocentesis there will be a normal finding, except there will be a mild inflammatory finding. On X-ray there will be a joint space narrowing, subchondral cyst, subchondral sclerosis, and there will be an osteophyte formation. That So these findings will confirm osteoarthritis. How we will treat it? We will treat it with lifestyle modification, medical therapy, and a surgical treatment. So it's concluded our lecture on osteoarthritis. If there is still any question or query, you guys can ask.